For the first time, Colorado Parks and Wildlife has killed a wolf, potentially tied to multiple livestock attacks. Thanks for joining us. I'm Jennifer Meckles. This includes the death of a calf on a Pitkin County ranch just last week. 9 News reporter Evan Krugel spoke with the ranch manager who found that calf, and they're glad this action was taken, but they don't think this is the end of it.
Yeah, Jenny, Tom Harrington runs a ranch in Pitkin County where one of those attacks took place last week. He's relieved CPW took action, but he questions what the impact will be. Life on a ranch requires hard work and long days.
Well, that's that old saying, and ranchers' work is never done.
It's a messy job for Tom Harrington, but one that comes with an amazing view.
So that's Mount Sopris. I like looking at it from here.
He's been a ranch manager on the Crystal River Ranch for 17 years, where he's responsible for hundreds of cattle.
I know so many of these cows. Like, we could go across a pasture and I could tell you about this cow and her first calf.
Tom cares about these cows, which made last Friday one of the toughest days on the job yet.
We got notice that the wolves had come across from the crown from the east. And so I sent our foreman up there, and sure enough, we found a dead calf after we'd been notified of this.
Tom says a second calf was also injured, leading to this plea for CPW.
Well, ideally, if they came and picked up every wolf, it'd be great. We know that's not going to happen.
Just hours after our interview with Tom at the ranch on Thursday, he found out Colorado Parks and Wildlife had killed a yearling wolf believed to be involved in 4 depredation events over an 8-day period in the region. It's the first time the state has done that since bringing back the wolves.
I found out, and I'm glad they took that action. It was appropriate. It followed the wolf plan.
Tom questions how successful it will be, considering the remaining wolves in the pack have a history of depredation.
I don't know if it's going to make a difference down the road. In my mind, these wolves have still got to eat, and they've already shown that they are willing to prey on livestock in order to do that. So we'll see if this removal of a problem wolf makes a difference in behavior of the pack. I sure hope it does, and the ranchers can get some relief and just keep doing what we're supposed to be doing, is ranching and raising livestock.
We do know the wolf that was killed was born last year. It's part of the Copper Creek pack that was moved from Grand County to Pitkin County after multiple livestock attacks last year. Now, CPW says it will monitor the remaining wolves in that pack to see if this changes their behavior. Jenny, still so many questions about what the impact will be from this moving forward.
How would they know it is the exact wolf? Because if it's a pack, how do they know it's the right one?
Short answer, they don't. We pressed them about that today, asking, how do you know exactly that 2405 was the one involved in any of these 4 attacks? They couldn't tell us how many it was actually involved in, only saying they used GPS collar data to track it in that vicinity. They do believe it was involved in some depredation. We just don't know how much. And so that's the big question. If this wolf wasn't involved in all of them and other wolves in that pack are committing these same attacks, how much work does this really do removing one wolf from that group?
And I forgot that CPW can track them with these collars. And is there my understanding is there's like a notice system to ranchers, a wolf might be in the area. Did they get any notice about this pack, this wolf?
Yeah, that's a big thing they're trying to do moving forward. Regional managers are supposed to be giving ranchers heads up if they see a wolf moving into that area. Tom says he did not get that heads up until after that calf had already been killed.
Interesting. All right. Evan Krugel, thanks for following this story.
Yeah, you bet.
Let's check in on your forecast now. A live look across the state. Not too much to complain about today. Nothing but sunshine and warm temps as we continue this warming trend. The perfect weekend to go out, enjoy all the fun events happening in Denver right now. We've got a celebration of the recently reopened 16th Street. Let's bring in 9 News Weather Impact Team meteorologist Corey Reppenhagen. Not all sunshine your track. You got a couple isolated storms in there too.
Yep, just some isolated storms today, maybe a little bit more coverage tomorrow, but I think tomorrow is going to be pretty nice with lots of sunshine and very warm temperatures. Here's a live look over Lookout Mountain. Those storms have stayed out of the metro areas so far today, and that will likely stay that way. Here's a look at the live radar picture. You've got a batch of thunderstorms over the Pikes Peak region out near Fremont County, but for the most part, these have been very short-lived light showers moving through the area, staying out of the Front Range metro areas. And I think it probably will stay that way, although we will get a couple of temps over the next hour or two. Temperatures really warm, 79 degrees here at 9 News Studios, 77 out at the airport at the moment. The temperatures tomorrow will be very warm, as we could make it up into the upper 80s. We could make a shot at 90 degrees tomorrow, would be our first of the year. Lots of sunshine early. The afternoon thunderstorms will start to fire over the foothills by about noon, and then try to move over to the Front Range metro areas by about 2 o'clock. I'll have details on that coming up in the forecast. Just a few minutes, Jenny.
All right, Corey, thank you. When the Boulder Abortion Clinic closed its doors this spring, it marked the end of a 50-year legacy of one of the few places in the whole country offering specialized later abortion care. Not for the people inside, though. 9 News reporter Rhea Jha spoke to the former staff who are now working to open a new clinic in Boulder.
This job changed my life.
The people who worked in this building had a mission.
This was one of the 5 clinics in the country that worked in this space.
The number of clinics in the country offering later-term abortion care turned to 4 when the Boulder Abortion Clinic closed in May. The staff lost their building, but not their purpose.
So we collected ourselves together and discussed if we wanted to continue forward and open a new clinic.
They're calling the new clinic RISE Collective. RISE standing for Reproductive Integrity, Safety, and Equity.
Absolutely.
Alicia Moreno is the new executive director, and she's bringing all her former coworkers with her.
So the staff that we have and that has been together for an average of 17 years has a really unique set of skills in a very niche part of this type of healthcare. We can't imagine not working together.
It includes people like Debbie Riccioli.
I was employed there for 11 years. We had patients traveling from all over the country and all over the world.
As the former director of counseling, she knows the demand for their care hasn't disappeared.
People were under an incredible amount of stress. They're afraid, they're worried about being judged, they're scared of a medical procedure, they're sad because they're losing a pregnancy. And with all the restrictions in the country, the need for our services are going to just continue to increase because folks aren't able to get their needs met sooner.
New name, same mission.
Approaching this with the same compassion and safety that we've done for many, many years.
And a team that never stopped.
The original clinic closed because the doctor who started the practice retired. The RISE Collective team said they do have a location set in place and are now working on fundraising, hoping to open by the end of the summer. Rhea Jha, 9 News.
All right, Rhea, thank you. Guidance is changing around who should get an updated COVID vaccine. The CDC says kids should still get the shot, which is contradicting what Health Secretary Robert F. Kennedy Jr. announced earlier this week. On Wednesday, RFK Jr. said the COVID shot would no longer be recommended for healthy children and pregnant women. RFK is a well-known vaccine skeptic. On Friday, though, the CDC's updated the COVID-19 vaccine schedule and put healthy kids on the list, with a caveat saying children can get it after caregivers consult with a doctor. The CDC was less clear on pregnant women, saying no formal recommendation there. A lot of doctors are still hoping their pregnant patients will consider it, like this doctor, Dr. Abigail Barnes, an OBGYN with HCA Health One. She says pregnant women are at a higher risk for more severe disease and preterm delivery from COVID. Regardless of the feds changing guidelines, she says her practice plans to keep recommending the vaccine to their pregnant patients.
National recommendations are varying as they come out of the CDC, et cetera, but ours would still be the same. And it'll be a matter of navigating access to vaccines, whether or not they're available in our cities and our small towns, whether or not insurance will cover them.
Vaccine hesitancy has been on the rise for years, especially the COVID years. Dr. Barnes says she's having more challenging conversations with her patients, but says it also opens the doors for more productive discussions.
I don't see that necessarily as a completely negative. I think it can bring a lot of positive conversations and good understanding between providers and their patients.
So federal guidance can also affect insurance coverage for vaccines. That's something we talked about with Dr. Barnes as well. She said sometimes the cost of a vaccine, especially if it's out of pocket, can be a barrier for a patient who might otherwise be interested in one. Also in health news, big funding cuts are planned for the National Institutes of Health. All of this laid out in a budget proposal for the U.S. Department of Health and Human Services. HHS is trying to consolidate more than 24 agencies down to 8. This includes the CDC and FDA. The budget outline also allocates $95 billion in discretionary spending for RFK Jr.'s Make America Healthy Again initiative.